All right, so here we go. We're going to get started with our exercises for the medial epicondylitis. So essentially, as you see in the video, I'm kind of saying, ouch, my elbow hurts. I'm showing we're going to be using one piece of tubing down on the ground, and then I've got one hooked into the door. We're just going to use some resistance across the room. Now we're going to start with mobilizations. As you see, I start off kind of light and easy. Now with this one, I like just gripping the wrist and sliding back and forth. Now, because we are not just trying to get the elbow, not just trying to get the wrist, we're trying to get the elbow, you can kind of drop it. Notice I start to kind of change my arm position each time. The lower down you drop the arm, the more you're going to stretch forward. We're just mobilizing, not just the muscles here, but you also have a big nerves that go down here. We're just doing a back and forth. We go through about 10 mobilizations here with the elbow and wrist. Okay? Now we're going to do some kind of flossing. As you notice, when I'm above, so on the upper part of the arm, I'm going to be pushing onto the muscle and going through ranges of motion. When I'm above the elbow, I'm moving the elbow. When I'm below, so when we get down into the forearm, I'm mostly moving the wrist. And I'm not doing like a specific number on this. I basically just think I'm going to be going through ranges of motion. I believe we go through 10 here of just motioning the elbow and then moving that into the wrist and just trying to work those muscles. So as you can see, I'm pushing on trigger points, pressure points as we go through movement and mobilization. Again, rule number one, no pain. This cannot hurt. If this hurts, you're going backwards. You're going to irritate it. But if it feels good, just like a light stretch or pressure, okay, so we're done with the mobilizations. Now we're going to go into the exercises. Now with this, I am using a grip, but it's a straight grip. And what I'm going to do, we're just rolling the wrist. Again, this is for the elbow. It can help the wrist too. We're going to do 10 forward and 10 backwards, okay? We're just rolling the wrist, and you should feel it in the forearm, the wrist, and into the elbow. Then we're going to go into a little more specific for the elbow here. So I have some resistance. I stabilize on the knee. We go forward and then rotate the wrist. We're going to do 10 of these where you go back, elbow comes forward, then the wrist goes with it. So there's two distinctive moves here. So it's arm, wrist, back, arm, wrist, back, okay? Making sure there's no pain. We're going to go through 10 of those. There we go. All right. Now we're going to go back into the wrist rotations. Now on this, I actually give a little more resistance this time. 10 rotations forward. Notice I'm kind of putting pressure too. If there's any pain at all, you can just put a little bit of pressure and then 10 rotations backwards. Make sure this feels good. I'm just gripping the grip. I don't even have a hand linked through. Now we're going to go back into that inner rotation, internal rotation, or extend the arm back, bring it flexed forward, and then it flex the wrist. And you want to drop that wrist. And this is one where when you drop that wrist, you really want to be thinking, I'm flexing into the elbow. This is, again, for medial epicondylitis. It's for this inside part of the elbow. We're going to go through one more rotation here. With the rotation, a little more resistance again, okay? And forward, 10, making sure there's no pain. Nice, easy forward rotations. Then we go backwards rotation. It should feel comfortable, should feel good. Okay, and then here's our last one with that internal rotation. So elbow, internal rotation, and then drop the wrist forward. We got 10 of those, flex forward. There we go. Hopefully this all makes sense. If you have any questions, go ahead and send us any comments. You can DM us and we'll try to get back to you as quickly as possible. There we go. All right. And drop that wrist forward. Okay, now we're just going to go into, now this is more of a mobilization. It's a prayer and reverse prayer. So the interesting part with this one, the lower you drop, the more you're going to get to the elbow. This is a great one for the wrist as well, for like carpal tunnel, things like that. But when you're doing especially the reverse prayer, you really want to kind of drive your elbows forward. The more you push your elbows forward, the more you'll feel it into the elbow, into that medial epicondyle. The more you push into the wrist, the more it's just going to be a wrist stretch and mobilization. We're going to go through 10 mobilizations, okay? And then after we do our 10 mobilizations, just going back and forth, flex, then we're going to go into a hold. There we are, 15-second hold. Notice I'm kind of going even back and forth. The more you drop it forward, the more you drop it down. You want to fill it into the elbows, not just the wrists. This is great for the wrist, but again, we're trying to affect the elbows. Then we're going to go into our reverse prayer stretch. Again, I'm kind of pressing forward, driving the elbows in. The more you push the elbows in, I always move when I do my stretches. It just feels good to just mobilize, but we do about 15 seconds here. Okay, now on those stretches, you can go anywhere from 15 to 30 seconds, but go out, do this, do it every day, especially if you're having pain. You can do this once, even 3 times a day until the pain is subsiding. Even afterwards, you want to work on the strength. Just make sure you don't break rule number 1, which is no pain. So everything has to feel good. You can repeat this 1 to 3 times per day, especially while you're suffering with pain. Go out, turn your pain into power, make your weaknesses into your strengths, and get out of pain, right? Okay, see you guys.